Can somebody see this with the phone on? Is there a picture there?
Yes.
Am I in it?
Yes, you are.
Do I have more hair on the picture?
You do, yeah. Did you want me to get the makeup team? Wardrobe.
Okay, well, thanks everybody for coming. I'm here today with Dr. Thor. He's our chiropractor at the clinic, and he's just running a little bit. He just pulled in now, but he'll do the second part of the talk today. I'm the owner of Coeur d'Alene Acupuncture and Holistic Healing. We're on Sherman. I used to, when I moved out here, I had my practice for over 5 years in Pilgrim's Market. There was a clinic inside the market. But now we're on Sherman with a large team there. We have Dr. Thor, the chiropractor. We have another naturopathic medical doctor, Dr. Casey. We have a couple massage therapists. We have a couple other acupuncturists. My wife does holistic aesthetics there. And so, I'm sure I'm missing somebody. But we've got a great team there, and I love giving lectures here, so I'm glad that you came. Today, we're going to talk about inflammation and things that we can do to help resolve inflammation. And the way I like to talk and lecture, if you've got a question, feel free to raise your hand. We don't have to wait to the end, and I'd really like for you to get involved and interact with me. Okay, so inflammation is a response, our body's response to injury. What events cause inflammation? What kinds of things that can happen to us where we start to see inflammation?
Pain.
Pain is, yeah, but what things cause us pain? Pain is sort of a symptom of inflammation. An injury, okay, what kinds of injuries? Fall, right? Musculoskeletal injuries. What other things can cause injuries?
Breaking skin.
Like a wound.
What about insect bites?
Sugar. Yeah. Okay. So injury like a sports injury or a fall or fracture, right? Infection. So right, infection is injurious to our body, and that causes inflammation, whether they're viral, bacterial, or fungal. So diet, right? Right, food allergies, but who knows? What's the most popular diet in America?
Pizza.
Well, pizza. Okay, what? I heard it. Somebody said sad diet, right? The standard American diet, right? So, right, fast food and vegetable oils, bad fats, those certainly cause a lot of inflammation. So burns is like a type of wound, or wounds. And there's a number of things in the body that cause inflammation. Well, what is inflammation? Actually, I want you to guess. So let's talk about this. So the inflammatory response to a musculoskeletal injury is a crucial first step in the healing process, involving a cascade of events to eliminate damaged tissue and promote repair. This response includes cellular, physical, and chemical changes that can be beneficial for acute injuries. What are some of the signs of inflammation? Pain, right? Julie said pain. What also happens with inflammation? What else do we see? Swelling, edema, redness, bruising, yeah. So redness, heat, and loss of function. So those are the two that we missed there. But it's a complex process that involves the body's immune system working to repair and heal damaged tissue. So, with a musculoskeletal injury, you get a tear, you get a sprain, fractures, that damages cells, and those cells, when they're damaged, they release chemicals. Some of these chemicals include histamine, something called prostaglandins, but these chemicals cause blood vessels to leak fluid, which leads to the symptoms of swelling, pain, redness, loss of function, and heat. So there's the cellular response and the cytokine release. So I'm going to kind of go through this in multiple times just so it kind of sinks into like what happens in the body on a chemistry level and on a cellular level. So inflammatory white blood cells such as neutrophils, macrophages, mast cells, and lymphocytes, they migrate, they go to the site of injury. These cells then release inflammatory cytokines, chemicals which further activate the immune response, and that is what promotes the tissue repair. So that is a picture of a phagocyte ingesting either debris or some sort of virus. So macrophages and neutrophils, they engulf or they phagocytize, digest, they engulf and digest cellular debris and pathogens. So as the inflammation subsides, then these anti-inflammatory white blood cells come to the scene. These are things like T regulatory cells or types of T cells, but they're a type of white blood cell, and they help to restore inflammation and they initiate tissue repair. So while inflammation is essential for healing, excessive or chronic inflammation can lead to further tissue damage, to fibrosis, and even rhabdomyolysis in severe cases. Who knows what that big word is, rhabdomyolysis? Dr. Thor does.
Extreme muscle breakdown, and then it blocks up your kidneys.
Yeah, so your muscles, like, they atrophy and they break down, they get smaller. So it can become a vicious cycle in some cases, where inflammation can trigger a vicious cycle leading to persistent inflammatory state, which exacerbates tissue damage. So more and more in the clinical world and in research and at the medical universities, we're understanding that a lot of chronic disease is a form of this vicious cycle of chronic inflammation. So this was a whole special health report from Harvard talking about how to fight chronic inflammation. So this is an excerpt. They said, if you've ever twisted your knee, cut your finger, or been stung by an insect, you have firsthand experience with inflammation. The familiar sensations of pain, redness, swelling, and heat that result from an injury or infection are hallmarks of the inflammatory process. Inflammation represents an essential survival mechanism that helps the body fight off hostile microbes and repair damaged tissue. Yet, there's another side of inflammation that can be harmful rather than helpful to human health. There's evidence that inflammation, promoted in part by such factors as obesity, smoking, and a sedentary lifestyle, contributes to a variety of diseases. There are two forms of inflammation, acute and chronic. Acute inflammation comes on rapidly, usually within minutes, but it's generally short-lived. Many of the mechanisms that spring into action to destroy invading microbes switch gears to cart away dead cells and repair damaged ones. This cycle returns the affected area to a state of balance, and inflammation dissipates within a few hours or days. So chronic inflammation often begins with the same cellular processes, but it morphs into a lingering state that persists for months or years when the immune system response fails to eliminate the problem. Alternatively, the inflammation may stay active even after the initial threat has been eliminated. In other cases, low-level inflammation becomes activated even when there is no apparent injury or disease. Unchecked, the immune system prompts white blood cells to attack nearby healthy tissues and organs, setting up a chronic inflammatory process that plays a central role in some of the most challenging diseases of our time, including autoimmune disease, such as rheumatoid arthritis, it affects cancer, heart disease, diabetes, asthma, and even Alzheimer's. So, sort of summarizing, uncontrolled chronic inflammation is linked to many chronic diseases. Diabetes, depression, vascular disease or cardiovascular disease, inflammatory bowel disease like Crohn's and colitis, arthritis including osteoarthritis, rheumatoid arthritis, all kinds of autoimmune disease, Alzheimer's disease, asthma, pancreatitis, even obesity. So this innate inflammatory response has two distinct and active phases. In the first graph, we're looking at what it normally is, right? You have this initiation, it's more short-lived, days, weeks, short weeks, right? And then this healing or resolution phase, and that lasts longer, but that chronic inflammation eventually resolves. But in some cases, you get that start or that initiation phase, and then you get this inflammation that lasts longer, and it doesn't resolve, and that chronic inflammation persists. So here's a little video that kind of just talks about the inflammatory process and kind of summarizes what we just talked about.
Inflammation is a local immune response to tissue injury or infection, experienced as heat, redness, edema, pain, and loss of function. Immediately after injury, inflammation begins with brief vasoconstriction of the local blood vessels to reduce blood loss and formation of a clot to stop the bleeding. Then, stimulated by cell injury and death, local cells release vasoactive chemicals, such as prostaglandins and histamine, to dilate local blood vessels, leading to increased blood flow to the area. These chemicals also cause endothelial cells in small blood vessels to contract, opening spaces between them. This increased capillary permeability allows fluids and proteins to pass from the blood into the tissue. Next, during a multi-stage process called chemotaxis, circulating immune cells, called neutrophils, move out of the blood vessels to the site of injury and destroy pathogens and damaged cells. Chemotaxis begins when cells at the injury site release messenger molecules called chemoattractants, which cause local endothelial cells and circulating neutrophils to stick together. Next, in a process called diapedesis, neutrophils squeeze through the endothelial gaps. The neutrophils migrate to the injury site by following a chemotactic gradient. Upon arrival, the neutrophils encounter bacteria, engulf them, and digest them in a process called phagocytosis. After destruction of the bacteria and removal of cellular waste, tissue repair begins when locally produced growth factors cause local fibroblasts to begin dividing rapidly and secreting large quantities of collagen to reinforce the wound. Anti-inflammatory drugs inhibit inflammation by blocking production of inflammatory chemicals. The most common drugs for inflammation are non-steroidal anti-inflammatory drugs or NSAIDs, such as aspirin and ibuprofen. They contain an enzyme called cyclooxygenase, or COX, that inhibits the production of prostaglandins and several other inflammatory chemicals, thus reducing vasodilation, edema, and pain associated with inflammation.
Okay, any questions about that? I know there's some big words there, but.
Where do your NK killer cells fit in with all this? Are they a totally different thing, or are they?
Yeah, so they are part of your innate immune system. Yeah, I'm sure they're involved with the inflammation, but when we look at these inflammatory markers, they're not often talked about as much, but more for, like infections and your body's immune system. But they definitely have a, an involvement. Dr. Thor?
From what I remember, NK killer cells more deal with your own body's cells that have gone wrong, like cancer cells, or just because cells divide and they multiply so rapidly, there's always mutations. And NK killer cells kind of step in when, hey, this one ain't working right, and they blow it up.
I also remember NK killer cells were also really important, like with infections and with COVID, because I gave a lecture about, during the pandemic, we were outside, we were all doing like qigong and connecting with nature, and terpenes from like the forest here actually increase your natural killer cell function. And so the more you're spending out in the forest, the greater your immune system is. So doing forest bathing increases your natural killer cell function. So there's a lot of uses for that and more reasons to regulate. Like we know that the more you're outside, the more the terpenes and that the nature will help you and help decrease inflammation as well. And NK killer cells are part of that cytokine profile as well.
Mm-hmm. I've heard years ago people actually use turpentine as a remedy.
So I'm not sure what turpentine is exactly, since I know they use it to clean. What is it? Is it terpenes?
Or it's made from tree bark or something.
Yeah, oh,
And
that
it
makes
was a
sense.
paint thinner
Yeah, paint them
back in the day. But remember codeine and turpentine from way long time ago? But I don't know what that was.
I don't know.
just
Okay.
remember the name for a cough syrup that really, really worked.
Okay. Well, one of the companies that we work with in our office, actually the guy who started Thorn created a new company. It's a professional line company. But I don't know if this past winter or fall, if any of you guys had that cough that just wouldn't go away, like lasted a month or two. So they made something called Musolve, which is all these different terpenes. A lot of times people know about terpenes now because of like the cannabis and the different terpenes in cannabis, how it has different effects on the body. But plants, terpenes are all in nature. But so this was not a cannabis product, but it has been super, super helpful in resolving that cough. And these are different terpenes, like in limonene and all these different things like from the forest. But yeah, we're learning more and more about the essential oils and these components and the profound anti-inflammatory effects and other effects in the body.
Question. So I mentioned the NSAIDs for addressing the inflammation. I would assume that you guys steer it in a different direction.
Yeah, I'm gonna talk more about that in a minute. That's coming.
Okay,
So,
thank you.
yeah, that was a standard, probably something for drug companies or, the conventional medicine that just kind of talks about the inflammatory process, and their focus was on, how to stop the inflammatory process. So the inflammatory process, as we'll continue to talk about, is a normal part of the body, or process of the body, and so we don't want to necessarily stop that. So I'll talk a little bit more about that shortly. So actually what we're going to talk about now is some of these like sort of biochemical inflammatory processes that happen in the body, and then we'll talk about a few nutrients and botanical extracts that have been studied to show how they interact with these pathways. In that video, they were talking about NSAIDs like ibuprofen and aspirin and how they blocked the inflammatory pathways and help with pain and inflammation. And of course, we've all heard of aspirin and ibuprofen. So they focus on this cyclooxygenase pathway, COX pathway. So the COX pathway is a biochemical pathway that converts the fatty acid arachidonic acid into a group of compounds called prostaglandins, which are important for inflammation, pain, and fever. So when you take that and it blocks the COX pathways, that's where you get help with pain, fever, right? That's why a lot of people took aspirin. Where did aspirin originally come from? Or where did they first isolate the compound that makes up aspirin? Great. Okay, what about arachidonic acid? Who knows what that is? Arachidonic acid.
Sounds like spider.
Spiders.
Yeah, but it doesn't come from, not that I know, but. So a lot of times when you eat like red meat, there's quite a bit of arachidonic acid in red meat. So I regularly measure people's omega-3 levels, and so you look for a balance between like omega-3s, omega-6s, but arachidonic acid can be kind of considered inflammatory, so you don't want it to be high. However, as we'll talk about, there are important aspects for inflammation resolution from it as well. So just like with cholesterol, which I think I want to talk more about in a little bit, but like with cholesterol, we know we need cholesterol, right? So it's a major component of our body's physiology for it to run normal, but we just have problems if it's excessive. When we're talking about cholesterol. So with cholesterol, right, and we say that we do know that it's normal, we probably don't want to limit it too much. One of the things, like if you take a statin, which are conventional medication to lower your cholesterol, a lot of people have problems with that. Like, what are some of the side effects of statins? Yeah, and it lowers your, what does it lower often? CoQ10, right, which is important for mitochondria, right? And so mitochondria and CoQ10 is really important for heart function, for cardiovascular function. So there are people who can have a problem with that. So one of the supplements that I like to use that is very similar, because who knows where statins originated from, something natural.
Red yeast rice.
Yeah, red yeast rice. So it's a fermented rice product. And so they found this one chemical, but because it's created, by the pharmaceutical, like when you make a drug, if you're gonna put a patent on it, you gotta take like one chemical and gotta modify it because it can't be natural. So they did that. And so you're getting like one compound versus like in red yeast rice, I always forget the number, but I think it's like around 40 different compounds. But there's multiple compounds that are similar to these statins, but it's diverse and they have different functions and they balance each other out. So it's very, very, very rare that I see anybody have problems with red yeast rice, but it's very effective. But not all red yeast rice is the same. Like sometimes you can go to certain places, get red yeast rice, and it's like, well, it didn't work for me. Well, it may not have the full compounds in there. It may not even have red yeast rice in it. So it's kind of based on the experience. Just if you've tried red yeast rice and it didn't work, it could be the product. So it's important to find one that works really well. What was I going to say about that? So this is like kind of similar, with some of these natural compounds and the way they work on inflammation. So I'm going to talk about that again in a little bit as well. But so COX, these cyclooxygenase, there's COX-1 and there's like COX-2. These enzymes, COX-1 is constitutively expressed, meaning it's always present in cells. It plays a role in maintaining normal physiological functions, such as protecting the stomach lining and regulating blood pressure. COX-2, this is inducible, means you can create more of it, and it's produced in response to inflammatory stimuli. It is a major target for NSAIDs and is involved in the inflammatory response. So ibuprofen and aspirin, will block both COX-1 and COX-2. So what are some of the problems that we see with ibuprofen and aspirin? So look at COX-1. What is some of their functions? Yeah, the stomach lining, right? So what, that's one of the major things that happen. You get stomach bleeding because it affects that enzyme. You lose that protective effect of that enzyme on the stomach. So anybody know like some names of some COX-2 inhibitors? No. So there's one that they ended up specifying ones that go specifically, and they're trying to save and protect the stomach. Some of them are successful, but some of them have had other side effects, and so like Mobic. Gosh, there's one that I do prescribe that. Why can't I think of the name? Dr. Thor, do you remember some COX-2 inhibitors?
Tylenol?
No, that's not. Oh my gosh, it'll come to me. I have prescribed it. So some people do well with it, and they don't have side effects, and I will prescribe it. But I try to do things more natural. I don't know why I can't think of the name. Okay. So prostaglandins are hormone-like substances. But they're a type of like fatty acid. And they act as chemical messengers in the body, playing a vital role in various physiological processes. They're involved in a wide range of functions, including pain, inflammation, blood clotting, and regulating like ovulation and menstrual cycle, and some of the cramping that you get with your periods. So AA, anybody know what AA stands for? It sounds Alcoholics Anonymous, is that what you said? So you just talked about it comes from beef fats, arachidonic acid, right? So arachidonic acid will make leukotrienes and prostaglandins, and there's different types of prostaglandins that are involved with like inflammation. So cytokines are inflammatory molecules, or small proteins secreted by immune cells that play a crucial role in initiating and coordinating the inflammatory response, and they are essential for fighting infections, repairing tissue damage. So these include like interleukin-1, tumor necrosis factor alpha, interleukin-6, interferon gamma, and chemokines. So you may have heard of some of these. These inflammatory cytokines are essential for protecting the body from infections and injuries. But however, excessive or prolonged inflammation can lead to chronic disease, as we said, arthritis, asthma, cancer. So therefore, it's important to regulate the production and activity of inflammatory cytokines. So some of these labs that I work with, I regularly check for interleukin-6 if I'm concerned about inflammation, whether it's cardiovascular disease inflammation, inflammatory bowel disease like Crohn's and colitis, rheumatoid arthritis, okay? NF-kappa beta is another pathway. It's a key signaling pathway that regulates the expression of genes involved in a wide range of biological processes, including immune response, inflammation, cell survival, and it's a transcription factor, which means it controls which genes are turned on or off in the cells. But if there's a dysregulation in this process in NF-kappa beta, it's been implicated in various diseases like cancer, autoimmune disease, and other inflammatory diseases. So these are some of these like major targets that, whether they're medications, including biologics, will go after. The last pathway I'm just going to talk about here, because there's a lot of different pathways, but this is a common one called NRF2. It's like a cellular defense mechanism that protects against oxidative stress. So it kind of like helps with antioxidants, inflammation, and it's activated by various stressors, including what are called reactive oxygen species or pro-oxidants, and it triggers the expression of genes involved in detoxification and, again, antioxidant defense. The NRF2 pathway plays a crucial role in protecting against various diseases, including cancer, neurodegeneration like Alzheimer's, cardiovascular disease. And there are some compounds like sulforaphane, which is found in broccoli and other cruciferous vegetables that can activate this pathway. Curcumin. Oh, I didn't write where curcumin. Who knows where curcumin comes from? turmeric. So curcumin is an active compound in turmeric. It helps with musculoskeletal injuries primarily through its potent anti-inflammatory and antioxidant properties. It can reduce pain, inflammation, and muscle damage associated with injuries and exercise. So it has an anti-inflammatory effect through some of these signaling pathways that we have discussed, like the COX-2, the NF-kappa beta, the NRF2. It inhibits the production of inflammatory molecules like prostaglandins and inflammatory cytokines like tumor necrosis factor alpha, IL-6, IL-8. So these molecules contribute to inflammation and pain at the injury site, and these compounds from curcumin and other botanical compounds can help decrease those inflammatory cytokines. So again, there's a difference though between like using turmeric and specific, synthesized chemical compounds, just like I described with red yeast rice and statins. So you get more of a broad spectrum. There's different types of curcuminoids and different molecules. So it's more of a modulating effect and not like an in-your-face, over-the-top effect that your body doesn't know how to handle. We've been eating curcumin as well, not everywhere in the world, but people have been eating curcumin around the world for a long time, or ingesting them. And curcumin's hard to absorb, so getting, if you eat turmeric and you use it in curry or spices for a long period over time, you'll be able to accumulate and have an effect. But taking it like as a supplement, it's important to find ways to help it get absorbed. So at Pilgrim's Market, I like any of the Mariva curcumins because it's bound to like lecithin or phosphatidylcholine, which helps it get absorbed. One of the popular ways is using like black pepper, but who knows why black pepper helps with absorption? This is not my favorite way because it has been shown to help, but pepper and the black pepper piperin, it creates micro-inflammation in the intestine, and that inflammation allows you to absorb more curcumin. So I like some other methods, and they've been shown, I think, to be stronger. So I use something a little bit different in my clinic, but at Pilgrim's, I do like the Mariva brand. So Boswellia, similar. Who knows, what's another name for Boswellia? You guys are on it. It's an anti-inflammatory, which has anti-inflammatory properties that stem from its active compound, boswellic acid. Boswellic acid, in particular AKBA, has been shown to effectively inhibit one of the enzymes that creates leukotrienes, and leukotrienes are inflammatory mediators that contribute to various inflammatory conditions. So boswellic acid also interferes with the NF-kappa beta, one of the key regulatory factors, and production of pro-inflammatory cytokines like tumor necrosis factor alpha and interleukin-1. So by inhibiting this NF-kappa beta, boswellic acid helps reduce the overall inflammatory response. So in a very similar way to curcumin, and I like to use the two together. So those are two botanical extracts that are anti-inflammatory that I wanted to share with you. So another favorite of mine is EPA and DHA from fish oil, from omega-3 fatty acids, and they're known as being anti-inflammatory. So these omega-3s can help reduce inflammation by modulating the body's inflammatory response, influence the production of inflammatory molecules. They help reduce the production of inflammatory signaling molecules like cytokines and adhesion molecules, which play a role in inflammation. So EPA and DHA are precursors to SPMs like resolvins and protectins, lipoxins. These are special molecules that help resolve inflammation. We'll talk more about that in a moment. But everybody, it's important to get a good quality fish oil, okay? So first of all, if you don't want to take fish oil as a supplement, anybody know the best way to get your EPA and DHA from fish oil? So I measure people's omega-3 levels regularly, like all the time, every day in my office. And so I have been able to find what works and what doesn't. So what's a good way of increasing your fish oil, your EPA and DHA?
Sardines.
Sardines. Yeah, sardines. So if you didn't want to take a fish oil, Pilgrim's got great sardines that you can do. And it usually takes about 2 to 3 cans a week to get your EPA and DHA up. Okay? If you're going to take a fish oil supplement, it's very important that it is not rancid. So I regularly have my patients bring in their fish oil so I can bite into it and taste it for them, or they can do it. You can do it if you want, but I've done it a lot and it doesn't bother me. But if it's rancid, it tastes like, I'm allowed to say, it tastes like if you ordered fish from Denny's, right? It is not good. You just don't want to do it. Yeah, it tastes fishy, so fish oil should not taste fishy. Who eats sushi? Does sushi taste fishy? It does not, because it's fresh. It hasn't spoiled. So if your fish oil, if you bite into it and it tastes nasty, it is rancid. And that's going to cause inflammation, not help with inflammation. Yes?
I've heard if you get the nasty fish burps with that, it's usually rancid.
Usually, yes. Now, some people or some companies will enteric coat it so it goes past the sun so you don't burp it up. So bite into it, taste it.
Where does astaxanthin fall?
So astaxanthin is a potent antioxidant. I'm sure it has anti-inflammatory properties. We use astaxanthin a lot for like eye health and other, antioxidant health. I'm sure it is anti-inflammatory. And that don't you get astaxanthin from like seaweeds? Yeah.
What kind of test do you do to measure omegas in the body? Is it a blood test?
Yeah, it's a blood test. You can actually even do it through a finger prick, like a blood spot too. And then it also will tell you your arachidonic acid levels too, and your omega-6s. And okay, what's a plant version of omega-3s that people like to take to increase their omega-3s? Flaxseed oil. So it is very, very rare. I mean, I read that it's like 30% of people can take flaxseed oil and that it'll be created in the body to EPA and DHA. I don't ever see that in practice. Like, I think it's very small. So that's alpha-linoleic acid, and that is very important for you too. But if you're trying to get your EPA and DHA up in the body, you need to get it from fish oil. Now, if you are vegetarian and don't eat fish, or you have a fish allergy, there's now a product on the market called like an algae-based EPA DHA. Most of those have about 500 milligrams of EPA and DHA contain 2 capsules. Most people, if you're dealing with a chronic inflammatory condition like inflammatory bowel disease, rheumatoid arthritis, you're going to want to you're going to look on the label and see how much per serving, whether it's liquid or whether it's capsules, that you need to take to get, who wants to guess, how many milligrams of EPA and DHA total do most people need if they're battling inflammation?
2,000.
I heard different numbers. I like to do at least 2,000, 2,500, I think is really important, okay? So that's a lot of capsules. So getting the more concentrated ones, I do, at Pilgrims I recommend the Nordic Naturals. There's other good brands, but you can get it concentrated if you only want to take 1 teaspoon. If you want it, because it's hard to take a lot of capsules, so liquid's the best. But there's a regular version that's not as concentrated where you can do 2 teaspoons, but it kind of saves you money if you want to go that direction. Or you can eat how many cans of sardines a week?
2 to 3.
And salmon, right? Most people said salmon, so I was expecting everybody to say salmon. And salmon's great, but people eat 2 servings of salmon a week. Still, their numbers, maybe they're up a little bit, but most people when I test, if they're not taking fish or they're not eating sardines, they're going to be very, very low. Like undetectable a lot of times. Just like with vitamin D. If you're not taking vitamin D and you live up here, it's going to be low. Now, if you live in Japan probably and eat a lot of seafood and eat a lot of fish, I bet your numbers are a lot better. But if you like sardines, start eating sardines. But make sure it's good quality, that it doesn't have like cottonseed oil in it, good oils that they mix with like either olive oil or just spring water.
So how much flaxseed do you need to meet this standard?
Well, it's hard to say with the flaxseed oil. But my focus generally when I'm dealing with inflammation is more EPA and DHA. But flax oil, I mean, probably like a tablespoon. And you can mix that in with like olive oil, put it in your dressings, or find other ways to do it. So you can do that. But be mindful if you're trying to increase your EPA and DHA and you take like what they call those balanced fish oils that have omega-3, 6, 9, you're not getting that much EPA and DHA in there. And until more recently, most of the fish oil supplements, Like, you can take 2 capsules and get a total of 360 milligrams of EPA and DHA if it has what they say is in there and if it's not rancid, right? Like if you're going to like the warehouses and buying the fish oil there. So you have to take a handful and then it's not good, and who knows even if they say what they have is in there. So fish oil I think is really important. I wrote my thesis on this, it's important for everything. So fish oil, I like it. Yes.
I've heard that DHA is actually good as an anti-cancer agent.
So EPA and DHA, they do help prevent the neovascularization, they help prevent the metastasis. It is very important for cancer. We're talking about cancer being inflammatory.
Okay.
Yeah, as being an inflammatory mechanism. So what we're going to talk about now is specialized pro-resolving mediators, which they're finding cancer is inflammation. So I will regularly use SPMs as a supplement, specialized pro-resolving mediators, to help with cancer. So this is just this is more of a summary of what we talked about. I'm not going to go too much into it, but we're going to kind of transition. And Metagenics was the first professional line supplement company that came out with a supplement of SPMs, specialized pro-resolving mediators, which SPMs come from EPA and DHA and from arachidonic acid. Look at the third one from the left there. So arachidonic acid goes on to make these prostaglandins, which help with that initiation of inflammation, which is important. It's the chronic inflammation they're resolving, okay? And so EPA, DHA, they go on to make resolvins, lipoxins, protectins. These are called SPMs, okay? And I'm just going to refer to them as SPMs and not get too bogged down by that chemistry. So they found SPMs in all tissue. And that's what this is saying. They found it in your breath, in your brain, in your cerebral spinal fluid, breast milk, placenta, spleen, urine. It's like everywhere because it's important to resolve inflammation. Obviously, there's going to be different amounts based on different people, lifestyles, things like that, but it's there. So, resolution of inflammation. There's this Harvard Dr. Suran. He's the one who kind of conducted the groundbreaking work focusing on resolution of inflammation. New science on nutritional components that actively resolve inflammation. So previous science perspective was that inflammation faded out by itself. That just given time, everything just kind of slows down and inflammation just goes away on its own. And then the goal was just to block the inflammation. Resolution of inflammation but what they're finding now, and it kind of started over 20 years ago, was that resolution of inflammation is an active process and is necessary for healing. This is now supported by hundreds of research publications. Research keeps going into this, and this is really important. So you can block inflammation by using NSAIDs like ibuprofen, other interventions to suppress the inflammatory response. This provides temporary relief of pain and swelling, but it can interfere with the body's natural healing process, potentially delaying or hindering tissue repair. So like if you take ibuprofen to reduce inflammation and pain from a sprained ankle, that can help, but it's also not natural. So I like to use this analogy. When you have a fever, because you've got a virus, you got the flu, you got a common cold, you got a fever. What do most Americans who are following the standard American diet, we'll refer to those folks because that's not you guys, what do you do when you're sick and you have a fever? Aspirin, Tylenol, ibuprofen to stop the inflammatory process, right? To stop the fever. Well, fever is your body's attempt to raise your body's temperature so that all the enzymes in the immune system and the white blood cells and everything can do its job. Because that temperature activates them or it helps them function. So you stop it, you're creating chronic inflammation. So that is another mechanism. So we don't want to just block. I mean, there's a time and place. If you're really struggling, same thing with a fever. Like you got a little one and they got 105 fever, you may want to block it. You don't have to, because my son would regularly get 105 fevers and I would watch him and I would check, is he sick? No, he just has a very strong inflammatory response. And that makes him stronger, okay? So I don't want you to just have a child with a grandchild, whatever, with 105 fever, unless you feel comfortable watching them and know. But there's a time and place for it. Same thing as a time and place for NSAIDs. But we would rather do things more natural and not block the inflammatory and resolution process. So that's helping inflammation resolve. I love to use these SPMs. I use them a lot in my clinic because they're helping to resolve the inflammation. It supports proper tissue repair, prevents chronic inflammation, and can contribute to faster healing. It may take longer to see results in blocking an inflammation as it relies on the body's natural healing processes. So consuming foods rich in omega-3 fatty acids, which can help produce SPMs and support inflammation resolution. Although, as I'm going to talk about in just a slide or two, by reducing the SPMs or fish oil helps make, you need fish oil, you need EPA and DHA, but there's times where you just don't make enough of these SPMs, even if you're taking fish oil, especially if you're already inflamed. So this slide we talked about, but without resolution, inflammation can become persistent and chronic. So that's what we're trying to protect against. If you're young, you have optimal resolution. You heal quickly. You have low pro-inflammatory. You're not inflamed. You have a high efficiency of a stress response. The older you get, the less resolution, the more inflammatory state that you might have, and the less efficiency of stress response. So if you have chronic inflammation, this could be from injuries or from infections, poor diet. And then we talked about all these different chronic inflammatory disease like arthritis, cancer, type 2, Alzheimer's, atherosclerosis. SPMs, EPA and DHA convert into SPMs, but conversion it's a multi-step process that may be affected by a person's health status. So a lot of people are not good at doing it, so sometimes you need to take the SPMs either ahead of time or later when you're inflamed to help that resolution. This is just showing they looked at aged mice versus young mice and the magnitude of the PMN, the neutrophils infiltrating to that site. So in the young ones, the red ones, they don't have as much PMNs. It slows it down. It kind of stops that process. Basically, younger, you're having more resolution. This is women. They found that women make more SPMs than men do in general. This is showing, I like this one because this is giving 2.4 grams of EPA and DHA, and that's the amount kind of that I said that we should take, right? And so they looked, the control is in the blue or gray, and then metabolic syndrome is in the red. So if you have metabolic syndrome, you've got obesity, high cholesterol, high blood sugars, pre-diabetes, diabetes, right? You're not being able to convert and make as much SPMs. Yes?
Do you use SPMs for acute or chronic inflammation?
So I use them for different things, but it's to help resolve acute. So I'll share with you in just a minute how I use them in my practice. SPMs are reduced in obesity states. So if you're overweight, here they're just showing if you're the controls in blue, the obesity is in green. The first one's like if they make them obese using genes or genetically versus like even diet. It doesn't matter. If you're overweight, you tend to make less SPMs. This is the kind of same thing. And then metabolic disease. So these are all the different, those are like SPMs, those RV, all the different resolvins and lipoxins. But this is just kind of summarizing that it decreases the pro-inflammatory like adipokines that are like fats. They decrease inflammation. They increase adiponectin, which you want more adiponectin when you're to help deal with obesity. They increase macrophage like engulfing. Anyways, it just helps the healing process along. It's very helpful in helping with vascular disease, so cardiovascular disease. So a lot of research on that, including apolipoprotein E, which is leading to cardiovascular disease because it's a genetic condition where you have higher cholesterol, but that's also what's related to Alzheimer's. So everything in chronic inflammation all ties together. They're studying it for arthritis, brain, Alzheimer's, dementia, neurodegeneration, really, really important. Inflammatory bowel disease, Crohn's, colitis, And then this kind of summarizes it. They don't have cancer on this list, but cancer, obesity, metabolic syndrome, diabetes, aging, cardiovascular disease, peripheral vascular disease, inflammatory bowel disease, autoimmune, arthritis, inflammation. It's very, very helpful. Yeah, let's just end with this. I think this is it.
Acute inflammation is a natural and protective response to specific insults. Inflammation results in response to insults including injuries such as cuts, wounds, overuse, bacterial, viral, and fungal infections, and a poor diet. In addition, the normal aging process is associated with a mild pro-inflammatory state termed inflammaging. When left unchecked, inflammation becomes chronic and can lead to tissue destruction and pain. Furthermore, when acute inflammation is unresolved, it develops into chronic inflammation with progression to chronic illnesses. This protracted inflammation is associated with complications related to wound healing and recovery from injuries, cardiometabolic diseases including cardiovascular disease and diabetes, mild cognitive decline, mood disorder, pulmonary conditions including asthma and allergies, joint pain and stiffness, and overactivity. Recent evidence has now demonstrated that the resolution of inflammation has distinct and specific mechanisms of response and actions and differs from the causes and onset of an increasing inflammatory response. This distinct mechanism is not and cannot be considered the same as suppression or blocking of the inflammatory process. The resolution of inflammation is an active process that is controlled by SPMs, specialized pro-resolving mediators. SPMs are naturally occurring lipid mediators that are associated with omega-3 fatty acids including EPA and DHA. Resolution of inflammation is an active process that is regulated by SPMs. SPMs are a newly discovered novel approach to inflammatory response that use specific mechanisms to resolve inflammation. Inflammatory insults are associated with edema, which is one of the earliest events in acute inflammation, arising from increased vascular permeability. This is illustrated using the response to a cut as an example. However, the response to other pro-inflammatory insults is similar. Leukocytes, mainly PMNs, polymorphonuclear neutrophils, are recruited at sites of inflammation, transmigrate blood vessel linings, and accumulate in the inflamed site to eradicate what is causing an inflammatory response. SPMs don't inhibit inflammation, but rather help facilitate or support the clearance of inflammatory components and thus resolve naturally the inflammatory process. SPMs limit the further recruitment of PMNs, but stimulate the recruitment of macrophages that organize the clearance of inflammatory exudates containing microbes and dying neutrophils. SPMs stimulate macrophage phagocytosis, resulting in the removal of apoptotic cells and/or microbes and the clearance of PMNs from mucosal surfaces. A key component of the resolution process is enhancement of macrophage efferocytosis and bacterial killing, and to this end, phagocytosis has been established as a biological indicator of resolution in experimental, clinical, and animal studies. SPMs may also reduce pain and promote tissue repair and regeneration. SPMs are important naturally occurring mediators that function to actively keep the inflammatory response within physiological boundaries and accelerate the return to homeostasis. SPMs do not block inflammation, but rather support the unique and distinct resolution phase of the inflammatory process. Today, inflammation is considered the underlying issue contributing to many chronic illnesses. When left unmanaged, acute inflammation may lead to chronic inflammation. Even acute inflammatory conditions like infection and even surgical procedures contribute to unresolved inflammation. Clinical sciences now show that unique, naturally occurring lipid mediators can help resolve inflammation. These are called SPMs, specialized pro-resolving mediators.
Okay, I just thought that was a good summary of everything we talked about today. Kind of the last thing, just Dr. Thor is working a lot using the Softwave shockwave therapy, which is a natural way to help resolve tissue damage. They work in a lot of these similar mechanisms. So, you know, the SPMs work on the muscles or any musculoskeletal injuries, but a lot of these mechanisms and can be super. So one last thing about SPMs, because you guys asked me about this, I come back to SPMs. I use them in my clinical practice. Like, they're amazing after surgeries, like orthopedic surgeries. I've had almost every time I have a patient who goes to have an orthopedic surgery, let's say they get a knee replacement, the doctor will say, the surgeon will say, I've never seen anybody heal as fast as you've healed. All the time. So really, really important after surgery. I will use it when I'm working together with cancer patients, other musculoskeletal injuries, any inflammatory condition. But like, that's something really dramatic that you see, and the surgeon's like, wow, what are you doing? I've never seen you heal so fast. So, yeah, and the summary. But yeah, I think I'm so long-winded, I'm sorry. I want to make sure we give Dr. Thor enough time. So if there's any questions afterwards, we can talk more. But please welcome Dr. Thor.
All right. Okay. Well, thank you, Dr. Toby. And that was way more in depth than I went into. I gave a presentation similar to this at our own clinic. And so now you guys are armed with a lot of information about the inflammatory process and about how our body heals. So one thing that I deal with mostly acute pain, because as a chiropractor, people slip and fall, hurt their back, or sometimes it's just they slept wrong and all of a sudden they can't move their neck. And so when they come to me, generally people are in more of an acute phase, and we can get them working, we help loosen things up, and their body resolves. But as I've been practicing over about 5 years now, I started getting frustrated when I'd have chronic pain patients come in, and there's a lot of things that I can help with, but I started getting frustrated when I was seeing people with shoulder issues or knee issues, where my techniques, the tools I have at my disposal are not as effective. So especially with things like tendinitis. And tendinitis is you're dipping into that chronic inflammation state. So you're no longer having an acute injury where there's a quick flare-up of inflammation, but a slow build, a slow degradation. Maybe there's a flare-up here, but then it kind of resolves, but the injury is still underlying and still generally progressing and getting worse. Chronic overuse type things, maybe old injuries that didn't resolve completely are now getting worse as we're doing things maybe we shouldn't be, or just repetitive daily use of everyday life. So I started to look for different options. I started to ask around to colleagues, looking on chiropractic groups that I'm a part of, and one of the things that I found was extremely effective was shockwave therapy. And so as I started to look into it, I was amazed at what doctors were saying that was happening in their clinic. And then I ended up talking to one of my friends I graduated with, and he says they have this Softwave device in their clinic, and was just telling me it was not miraculous, but as far as the medical treatment go, he's like, I was amazed almost every week at some results that we were getting, that normal treatments, adjustments, physical therapy, that kind of stuff was not dealing with too well. So I started looking into it, and so we're just going to kind of go over what is shockwave therapy and what does it do and how it helps, all right? Okay, so first off, we'll talk about the Softwave specific. So Softwave, TRT, stands for Tissue Regeneration Technology. And what it does is it uses shock waves delivered with both a combination of electricity and water, and we'll kind of explain how that works, to deliver these shock waves into the body. So it's
even though you hear the word shock wave, what we're actually applying is a mechanical force. There's no electricity going through your body. We are insulated from the electrical spark, but you're actually getting hit by more of a ripple effect. Okay? So what the shock wave does is it stimulates your body's inflammation cycle and helps almost supercharge kind of what the healing is, what's going on. Have a little animation here, we can look at that. And what you're doing, what you're seeing is a little spark that is creating a shock wave within water. We'll do it again here. And then the head looks like a Fisher-Price flashlight. I'll show you everybody. What this does is this focuses that shock wave into more of a beam, and that's transferred through the body. So we'll do it again here. So you're getting, the red is where you're having the most energy go through, and think of it as a ripple. Or if you've seen Hunt for Red October, when there's deep sea mines going off and that shock wave's going off in all directions, well, this one's just focused out. All right. Okay, so where does shock wave come from? Where did we figure out this technology and all that? So back in the 1980s in Germany, they were messing around with devices to deal with kidney stones and gallstones. And they thought, hey, if we can somehow cause them to break up, we don't need to go in surgically to remove the ones that are too big to pass. So they developed shock waves. It started out, you had to get into a big bathtub, and then the device was in there with you, and they used that and were able to target the kidney stones, and because of the violence of the ripple, a stone doesn't flex or bend, and so that would start to break apart. And as they were doing this, they thought maybe we should do studies on what it's doing to the soft tissue that we're applying and the shock waves are passing through, and that they found that there were actually positive effects going on in the soft tissues. So the people that were exposed to more shockwave therapies, now these were very violent, oftentimes lots of bruising and everything like that, and still today when you get lithotripsy or shockwave therapy for kidney stones or gallstones, there is bruising because it's pretty violent. But they found that the tissues that were exposed to it generally were healthier than the surrounding tissue. So denser bones, thicker blood supply, and tendons and ligaments generally were healthier than the ones that were not exposed. So they started to look into what's going on, and they started to experiment with it. And the first non-lithotripsy uses was on non-union fractures, so on fractures that were having a hard time coming together and fusing and reossifying. They started applying shock waves to those, and noticed that it would jumpstart that unionizing, get the bones to start to form a bridge and to start to calcify and heal. So they started to mess around with all sorts of different musculoskeletal conditions. I think they moved on to calcium deposits in the tendons, so calcific tendinosis, tendinitis, and they noticed that the shock waves caused the calcium deposits to start to shrink and dissolve in the body to reabsorb that, and then the tendon to start to heal a lot faster without having to go in and start to cut out or using ultrasound and lavage to wash those things out, which can be, it's invasive and they'd rather not do that. So as they're specializing these devices around the 90s, they started creating ones that didn't require you to get into a bathtub, and they started creating portable or more hot office friendly devices. And they kind of divided into two types. So as you can see, we have radial and we have focused. Now, the most common you'll see, and these devices are becoming very common, especially with chiropractors, physical therapists, and sports medicine docs, most likely you'll be seeing radial devices. So how it does and how it works is, if you notice, the radial device, which is on the top, usually has a long skinny applicator. Inside that applicator is a metal projectile, and then it's connected to a pneumatic air compressor. So that air compressor will shoot compressed air, launching that projectile from the back into the front, and usually the front just has a metal head. So they will put some ultrasound gel on you, and then they'll click, and that projectile is hitting and hammering, and then the forces, the shock waves are produced. And what happens is there's no focusing, there's no applicator head other than that metal contact. So the shock waves disperse immediately from the point of contact. But it's very effective for joints that maybe are closer to the surface, do not have as much muscle or fatty tissue over them. So elbows, even some shoulders, or smaller people with less tissue density, radial is very effective. And these machines are a lot cheaper, so you'll find a lot more clinics acquire those and start to use those. In my research, I was looking at that one, and I was also looking into the focused shockwave, and in talking with a lot of different chiropractors, the focused, what that does is that starts and usually uses, this one uses electrohydraulic, the spark plug inside water. There's also a piezo wave, and I don't know how they do it, but some sort of electrical shock forms the shock wave. But what that does is they all have focusing heads. So that focusing head the shock waves will start here and tend to come to a convergence point. Now, those convergence points can be a couple inches deep, and these are what are used with the lithotripsy. Granted, these, those are different machines, but they are able to dial in specific focus points because you measure it with X-ray. But the convergence of the shock waves is much more effective, but generally ends up being a really small point. Okay?
What do you use it on?
For
The focus.
the focus one, so generally they'll use it for deeper tissues or deeper injuries. So they're still going to have that same shockwave effect, but for example, a radial, if I was going to want to do a hip labrum, there's a lot of muscles around the hip, and that labrum is very deep. It's up into the pelvis, and the radials there will not be enough energy. The shockwave will be dissipated. Your skin or your tissue will absorb it. So with a focused, they're able to get deep, and the shock waves will affect tissues that just are deeper.
How many treatments are you looking at?
It depends on the situation. So if it's a chronic, there's obviously more radials. Generally take more treatments than focused because they're not getting as deep. The Softwave usually takes a lot less, and we'll get into that on why. But a lot less treatments for the same type of conditions just because of the mechanism of how it works. But you're looking anywhere from 3 to 4 for an acute issue up to 12. Some people are doing 12 visits for chronic stuff that's just been going on a long time, or there's a lot of area to be treated. That can change how often you have to come in.
Is that a focused shockwave then?
This is technically a focused, but it is, we'll get into what's different about this one, yeah. So, just overall, the benefits of shockwave therapy, we got them right there. It's drug-free. It provides general use, instant pain relief. There are no side effects. Now that's a caveat. You can have a little bit of soreness. I've never seen any bruising, but that is a possibility. But no different than a deep tissue massage. And oftentimes you can stave off surgery, especially with those conditions that surgery is kind of the only option, like calcific tendonitis or something like that. So this can help you avoid that. And the cool thing about it too is because it's just a mechanical ripple, you can use it pretty much anywhere, except for maybe your eyeballs. So you can use it on your face, you can use it on your elbows, you can use it on the abdomen. There are things that you would want to avoid, like cancerous tumors, pregnancy obviously, but anywhere on the body you can try it out, and it's not going to make anything worse. It's not going to damage anything. Okay, so there we go. Is this a video? Okay, cool.
What is Softwave therapy? When treating a patient, the provider will begin applying Softwave looking for any inflamed or painful areas. Once they have identified the inflammation with patient feedback, the clinician will provide shock waves until the discomfort has been reduced or eliminated. The pain relief is the result of multiple mechanisms of action, including the modulation of inflammation and neovascularity. Because Softwave delivers therapeutic levels of acoustic energy over the broadest treatment area, Softwave therapy will always require the least number of shocks, the fewest treatments, and superior outcomes with the least pain, at energy levels that do not cause cellular trauma or injury. Softwave is the only device that utilizes patented parabolically focused shock waves to effectively treat pain. This technology generates electrohydraulic parallel acoustic waves that provide the largest and deepest therapeutic treatment zone. Soft waves trigger a biologic response up to 12 centimeters from the spark discharge and initiate healing at a cellular level over the broadest possible area, dramatically reducing pain with the fewest number of patient treatments. How does it work? Softwave's acoustic parallel waves activate cellular receptors, initiating the body's own natural biologic healing response, non-invasively and without drugs or injections for pain. Softwave is the only device that utilizes patented parabolically focused shock waves to effectively treat pain. This technology generates electrohydraulic parallel acoustic waves that provide the largest diagnostic and therapeutic treatment zone. Softwave technology is validated in hundreds of international publications, holds dozens of patents, and is used by leading national and international research and medical centers, as well as major sports team physicians, from NFL, NBA, MLB, and other national sports organizations. Catch the wave and join Team Softwave.
Okay, so you heard a couple big words like parabolically focused shock waves. So in summary, how this differs, technically it does fall into that focused category, but what they do and how they've explained it to me is it's technically a long focus. So whereas generally focused shock waves, they pick a point usually 4 or 5 centimeters deep, maybe a couple inches, and all those shock waves converge onto that point. Whereas with this one, the focus point is technically pretty far. They didn't give me a specific, but it's well past the effectiveness of the shock wave. So what's happening is, realistically, they're pretty much a parallel wave. So you're getting the depth of a focused without getting a pinpoint shock wave all converging on one spot. So you're able to treat a broader area with one pass. So as we're using it, it's more like painting with a roller rather than a detail brush. So generally it takes less treatments because you're just going, and less time to be able to treat the same amount. But you're still getting the depth and the benefits of the focused. And then we'll go on to effects here, but this is just kind of what sets the Softwave apart. We talked about it a little bit. One thing I also really like is because there's more of an unfocused beam, you're getting the depth, but there's a lot less soreness when you're dealing with the Softwave as opposed to a focused. So you're still getting deep enough, but you're not getting as much soreness afterwards. So that was important to me because I want people to be able to use the device and not call me up and say, hey, what the heck did you do to me? Another cool thing of what this does is every shockwave is a little bit varied on the depth. So that helps your body not to get used to it, so you know what you're actually feeling is a correct response, as well as sometimes your pain tolerance, because it's not comfortable, it's definitely painful in the moment, can kind of push forward and maybe push deeper without having to. If it was always deep, you might not be able to stand it for very long. So how is the shockwaves working and what are they doing to our body? So this is where we can call back to Dr. Toby's presentation on how the body works with inflammation and the healing response. So first off, with inflammation, one of the big things that is released when we first get beginning stages of inflammation is something called substance P. Substance P signals inflammation to start, as well as decreases your neurons' threshold for excitability. So what that means is it's easier, the spot that's inflamed pain starts to increase. It takes way less pressure or irritant to cause pain. So when we're able to decrease substance P in an area, that's also a signal for the body to move on and start to work. And then we also have other cytokines, everything that Dr. Toby talked about to call all the cavalry to the area of the injury. All of your body's healing, this activates that. So how does it do it? What it's doing is those shock waves, they coined the term micro-trauma. So we are basically pulling the fire alarm without having a fire. So when we are applying the shock waves, especially over an area that does have an existing injury or maybe some inflammation, the body thinks there's a massive injury going on. So imagine or think of when if you have a chronic pain that's slow to build, a tendinitis type injury, what happens is there's not one instance. It's been building for a long time. So your body tends to kind of push it to the side, ignore it, maybe start the inflammatory process, but because nothing's being done about it, or you continue to use it or degrade, it doesn't completely heal. As opposed to if you were to fall and break your ankle, there is a massive healing response. There's immediate swelling, you can't touch it, and the body's working as hard as it can. So what the shock waves do with that mechanical force, it fools your cells into thinking there's a massive injury, and so it responds with a massive healing response. Now, because this all it is a mechanical ripple, there's no damage being done, you're just getting the benefits of that massive healing response in an area that doesn't have a massive injury. So everything shows up, everybody's processes are elevated, and then they should do what they can. It's like pulling the fire alarm, having the firemen show up, but maybe you just happen to do yard work instead. Okay? So another thing that how shockwave works in increasing the healing is increasing energy production as well. Energy production is very important when we're healing, and so increasing that, the Krebs cycle, the lactate concentrations, helps the cells to have the fuel and food that they need to keep going, as well as reducing the rate of cell death. It keeps the cells working longer. All of these processes are activated when you have a massive healing response, so this is one of the mechanisms for that. Another one how this works, especially with pain, immediate pain and immediate effects, is it causes nitric oxide release, which increases the blood flow. The most common feeling that my patients have reported afterwards, after their first treatment, is, wow, it feels warmer, it feels looser, okay? Generally, there's some decrease in pain. Oftentimes, it doesn't take it away right away, but especially with me, when I've done it on myself, it feels like I just got a really good massage afterwards. So there's increased range of motion, heat in the area, and that's because of the increased local blood flow, which is very important. Now, blood flow, temporary blood flow is great, but permanent blood flow also helps keep that healing and longer, and is one of the things, especially with tendons, which have a poor blood supply to begin with, helps them to continue to heal even better than they would have on their own. So the shock waves cause the cells to reduce or to release vessel growth factors, and then the body will start to grow new blood tissue and new blood vessels, thicker capillaries, beds, and all that kind of stuff. And then I remember in Dr. Toby's presentation, or it was one of the videos, they talked about fibroblasts being activated after all the cells were, after the injury happened, inflammation went up, and then as it's coming down, the repair and regeneration starts. So this increases the activity of the cells that are responsible for not only clearing away damaged tissue, but increasing the activity of laying down new tissue, remodeling scar tissue. There's a lot of different phases to the healing process. And so inflammation is the first one, then you have the repair phase, and then you have the remodeling phase. So this can help speed up and activate all three of those phases. There's even been studies showing that it actually helps nerve cells to re-innervate the area as well. So there's some people that with neuropathy that benefit from shockwave therapy as well. So I, as a chiropractor, generally deal with the musculoskeletal, but there are multiple different applications for shockwave therapy, especially with the Softwave and how the applicator head is designed. So there's aesthetics, there's urology, endometriosis, helping with the inflammation there, PID, and they're using it with diabetic ulcers to increase the blood flow of the tissue and activate the repair there. So just because it's using your own body's healing factors, there's a lot of different applications. So. All right, so I brought the machine here, that's why I was late. So I wanted to see, is there anyone who would like to try it out? Okay, so we need access to the skin, and we don't want to disrobe in front of everyone. So what do we have going on, or where would we want to try it out?
I had last June, I broke my wrist.
Okay.
And I had surgery, and it was like this when I got back up.
Okay.
And I don't know if you can work on that area.
We can definitely try, yeah.
I don't know, but I still don't have, I'm still trying.
So you have limited range of motion?
Yes.
Okay, yeah, so let's bring your chair up here.
Well, let's move this.
This area can affect me.
Yeah, that's where all the muscles that
Yeah.
move your wrist are all up here. What we're gonna do is now, if this is bony mechanical interference, we're not going to be shaving down your bones with this stuff. But what this can do is help loosen up the ligaments, help with the tendons, as well as the muscles as well, activate the muscles. Now we're only doing one treatment, so we're not going to get all of those benefits, but you can at least see how it feels, and everyone can see it in action. So the way we work, and the way it goes, is I control the frequency, so how fast and how often it clicks. I also control how the depth or the energy, how hard it clicks. So in a treatment, what we'll do is we like to start really low, and we get the patient used to how it feels, and then we slowly increase the energy as we're going until you start to feel pain, okay? Pain means, hey, there's something going on that we need to affect. If we're going through, you're not feeling any pain, we're either going over perfectly healthy tissue, or we're not getting deep enough.
Let you know when I feel pain.
Let me know when you feel pain. Now, we don't want it to be unbearable pain,
Okay.
but we want it to, okay, yeah, that hurts, okay? I say land around a 4 to a 5 out of 10, okay? You know, if you get up into the 7s, that's okay, but if you're wanting to slap me or pull away, you know, we want to keep this PG, so no swearing. So we'll not do that strong, okay? Oh, that just popped. Oh, dang it.
So if I had this instead of, could I have healed it without surgery?
It depends on what was going on. Like I said, if your body could have done it,
Yeah.
this just helps your body have the capacity to do it.
Well, I know they had to reset it in ER. And
Yeah.
they had to reset it again during surgery.
Yeah,
It was pretty bad.
yeah. So they definitely surgical probably would have been the way to go, but this could have helped recovery better. Okay, so this is leaking, so we're probably not going to only be able to do one. A pinhole probably from transportation here. So.
Oh, that's too bad. Can it be repaired?
Yeah, I have extra membranes. I just left them at the office. So, all right.
So see those.
Yep. Okay, so what we'll do is we got it pretty low. And we will just start. So what do you feel? Can you describe it for me?
I'm feeling too much, yeah.
Just a little clicking. All right, so we're gonna bump it up.
I think a little bit, just like, you know, I don't know if it's,
Tingle.
because I do have arthritis in here.
Yeah, and
So
this
I
will
can feel
make that
it.
arthritis.
Yeah.
You'll probably feel that
Yeah.
for sure.
Just around it. I kind of calmed down. Yeah, right there I can feel it.
There you go.
Oh, yeah.
Oh, yeah. Okay.
Oh, yeah.
So in a normal course of treatment, what we do is, okay, this is a spot that needs some help.
Yeah.
So we will just hold this at a bearable level, but where you're feeling it. And then what you'll notice after about 10 to 30 seconds is the pain will start to decrease,
Okay.
even though the power is the same. Once we get that response, we move on to a different spot, okay?
Kind of like a steady pain.
Yeah.
Maybe south a little.
Yep. And you got hardware in there, which definitely, this is paying off the hardware,
Yeah,
so
yeah.
that's okay. You notice it doesn't hit the same every time.
Oh, yeah, it doesn't, yeah. I might be getting too the arthritis in my head area.
Most likely, yeah. But are you noticing it starting to decrease a little bit? No, it's still pretty good.
It could be that, because the arthritis is kind of in
Yeah.
that area. Yeah.
Let's let it go for a little bit longer, and then let's give that spot a break. Let's come over here.
Is this something that you would use only in your office? It's not something that a patient would take home and
No.
on there?
It's like, it's hitting like nervous.
Yep, it can be bouncing off nerves. Yep. Yeah, they come to the office, they can't take this home.
Or they don't buy one for their personal use?
Yeah, you have to be a licensed
Even though
provider.
it's a chronic situation for
Right.
them.
Yeah, you have to be a licensed provider to buy them. Now, I'm sure you can find some. I know some of the radial devices, there are some that are being made in China that they don't require, anyone can buy them. But those ones don't have FDA clearances or anything like that.
Yeah.
So what does it charge, what do you charge for like a session?
So I charge for a first visit, that is really strange. So for a first visit, I charge $49. Okay, so let's see how that goes. I want you to move your wrist around and see how that goes.
It feels like you said looser.
Yeah, looser, huh?
Much looser.
So,
Yeah, I don't know if it's whatever, but much looser.
yeah.
Yeah.
And we didn't even wait for you to get that full response. So
Yeah.
a full treatment, I probably would have gone, so I just did 419 clicks. Full treatment, I generally stick around from between 1 and 1,500, so 1,000 to 1,500 clicks. Yeah, I'll just throw that right there. I think I got enough water for maybe one more, and then I gotta go drain this so I can replace it. Does anyone else would like to try it?
So it has water in it?
Yep, water in it. So what you're hearing, there's a pump trying to do positive pressure, and there's a little micro hole, probably from transporting it, that now it's just pumping out water. But
I'm having nerve pain here. What I think it is maybe a pinched nerve in my back or something.
Okay.
But I have this jolting nerve pain that goes up my neck.
up the neck. Okay, yeah. You want to
Does
come
that
up?
do anything for it?
Totally, yeah. Now, because this is got a little hole in it, it's going to be spraying water all over you. So I apologize for that. So what we'll do is we'll just hold that right here, and then let's get your hair out of the way. So when you're moving around, where are you feeling it the most? Right there. And so let's show everyone range of motion. Going to the right, go to the left. Let's look up and down. So going up is where you feel it the most.
Going up or to the right?
To the right. Okay. All right.
Okay, so we're gonna get your chair out of the way, and then let's actually rotate you a little bit so people can see. Make sure you don't get all soaking wet. So most of your pain you feel up through here,
Yes.
right on the side. How about like this muscle down there that goes down?
Not so much.
Not so much, just
It's
focused right through there.
through here.
Okay, so we're gonna turn you down here. All right. Tell me when you start to feel it. Slightly right there. Okay, so I'm gonna bump it up then. Come on now.
I feel it more.
Okay. And we'll move up and down. And a lot of times this first visit when I'm working with patients is more we're just trying to find what hurts. The cool thing about this is it is somewhat diagnostic, whereas it can tell you especially where the injury is, even if that's not where you're feeling the pain. I have a lot of knee patients that they'll say, okay, I'm hurting right here, and I end up moving all up in here, and you start getting a lot of pain here, maybe not necessarily along the side. So we just treat where this creates the pain. How are we doing?
It's okay.
No pain? Means we gotta keep going.
I feel it.
And a lot of times with my neck patients, I end up going way down into the trap muscles. So we're not gonna be able to do that here because we can't get past your sweater, but very few times have I actually found neck pain here when that's where the most of the complaint is. I often find it down here through the shoulders, but this will still work on the muscles, this will still loosen them up. I've had patients where traditional muscle therapy like massage and stretching, yoga, exercise, chiropractic has been effective but hasn't been resolving the issue. And then a few treatments of this was able to get the muscles to loosen up enough to where then conventional therapies were way more effective afterwards. So it wouldn't replace those, but sometimes this can just give you the boost you need. Okay, we're gonna go up one more because how are we doing here? Any pain?
Well, I feel it a little bit more right there.
Right there?
Yeah.
Let's lean away from this. There we go. Let's try that. Let me know when it just kind of starts to fade away. Good. Okay. Let's see how that does.
In the session with this, do you couple it with chiropractic or do you keep those completely separate?
It depends on the patient. If they need chiropractic, I offer it. Some people they have their own chiropractor and they're just come in to do this. Other patients, what we've done is, there was one that she has stenosis, which is the narrowing, sorry, I'm just gonna get you a little bit more. Narrowing of the openings where the nerves exit, and so I can't fix that, but what ended up is we loosened everything up, we calmed the nerves down, and now she just comes in for chiropractic and she's able to stay on top of it, whereas before she was contemplating surgery to get a neck fusion. So, oh, how does it feel? Move it around, let's test it out.
Oh, it's.
That's way farther than where you're going.
Oh, yeah, because I could hardly turn it maybe here before, but I can get farther.
Yeah, and I guarantee if we had gone deep into the traps and everything, it would be that much more effective.
Yeah.
So, okay, I apologize that I'm leaking everywhere, but we're
Can
gonna.
you possibly do one more?
Sure, yeah.
Oh,
Do
good.
you need to empty it or something?
Nope, it's all self-contained.
I have
So,
a bag too if we're dripping.
I got plenty of towels here, we'll clean it up. So.
Mine is already here.
All right there?
I have them, I was leaning over, I was doing my lawn. Another guy,
Mm-hmm.
he saw me leaning over to get something, he came dashing over and knocked on the tree.
When did this happen?
Today.
Today, okay.
It's very, very sore here, I've got a headache,
Okay.
so you can help.
Yeah, so let's do this. Let's turn you around.
So turn me around.
Yep, and let's take the jacket off so I can get a little bit lower.
So this is something insurance.
Insurance does not cover everything. So this is fairly new here in the States. Like I said, it comes from Germany. To give you an idea, I graduated in 2020. They didn't even talk about it in school. I was hearing about it from local chiropractors, but they did not teach it. They might have mentioned it, but they did not teach it. And so insurances and schools are always the last ones on board. And so if you were to try to submit this to an insurance company, they'd say that's still experimental. But if you're starting to look at the research, most of the research done for shockwave therapy, is for plantar fasciitis. So a chronic tendinous ligamentous type injury, and this is quickly becoming the gold standard, shockwave for plantar fasciitis, because it's one of those things that you can't just not stay off your feet. And then either that or you go into a loop, and then what happens? Everything becomes weak and it becomes a self-perpetuating cycle. So, okay, let's fill this back up and start the waterworks. So what we'll do, and no pacemaker or anything.
Oh, no.
Good, okay, so we'll just work all through here.
Okay.
Get a new towel for you. And I'll just have you lean your head just slightly forward, perfect.
How long does the session last?
So with that last one, that was 400. So, and I'm going kind of slow. Generally, I'll have it up about 1.5 times as fast. But I end around 1200. So it goes pretty quickly, 10 minutes. Depends on what body part we're doing. So.
Do sometimes you work on more than one area, like if someone wants something done here or their neck?
Yeah. Generally, what I'll do is I separate out the visits per shocks. So, and I don't like to just skip around.
Mm-hmm.
So if we're going to work on the neck, I'll say we're going to do a full treatment on the neck, and then we can use another treatment. So they can pay for another one, or if they buy a package, they can just use 2. So a lot of times when they're doing knees, I was like, yeah, come in, we'll do both knees in 20 minutes. But they're using it's technically 2 visits. So, okay, I'm going to turn this down so we don't just blast you out of the chair here.
I appreciate that.
All right, I'm going to move this around. And we'll start down here and we're going to work our way up. Okay, so we'll start low. And it's probably pretty low power, so I'm not getting any tenderness. You're not jumping out of the chair on me, so let's go up. And a lot of times, generally, I kind of land, right now we're at a level 6, and that goes out of 16. For necks and most areas I'm landing anywhere between 7 to 9.
Has there been studies comparing that to like PRP, infrared,
Yeah.
therapy, stem cell?
I don't know about comparing, but if you think of the effects, what is PRP doing? It's introducing platelets and plasma, which that's what you're introducing when you're injured. This is just kind of trying to do the same thing, but through a different mechanism. So a lot of times what people will do is they will couple it. If they're doing PRP, they will also do shockwave to continue to just get an even greater effect. So when I'm going over with my patients alternatives, like, okay, so here's some things that are just as effective. We talk about stem cell therapy, we talk about PRP. PRP is coming down in price. It used to be extremely expensive, but there are clinics that are doing it for a lot cheaper. So, but it often depends on how many shots do you need. If you're a young buck and you just need you have knee pain from playing basketball or something like that, maybe one shot is all you need. But a lot of times for the best effects, they're combining. Hey, how are we feeling?
Keep going.
Feeling anything yet? How about here? Is that tender?
Yeah, it's a little bit tender.
A little tender. So tell me when that starts to get a little better, and then we'll move up.
It's so relaxed.
Good. Okay, how about up here? Any hot spots up there?
Yeah.
Right there? Okay, tell me when that gets a little better. Then we'll go to the other side.
That's pretty tight.
This one's hanging on, being a little stubborn. I thought that something was malfunctioning.
Yeah, just us.
Okay, let's move to the other side.
Okay,
So we can get anything up here. Or not as bad as on this side.
not quite.
Okay, so let's move down here. Anything down here at the base?
It's tight.
Tight right there. Okay, so let's let it. Once this starts to get a little better, then we'll clean you out here. Generally with patients too, what I'll do is we'll find all the spots with one level, and then we will go do it again with a higher energy. And so we're kind of doing every spot that we find twice.
We just found a spot.
I just found a spot. This is a very common spot too, right at the base of the neck, where the traps are starting to kind of get a little meaty. And right at the top of the shoulder blade is a very common site for pain and muscle tension, trigger points. Is it calming down?
It's starting to.
Perfect. All we're looking for is that response too. So a lot of times, we don't even need to wait for the pain to go all the way away. We're just looking for that response of the body to say, okay, we're letting go. All right, how does that feel?
Thank you. It feels like it's released.
Yes, good. And so for you, in your example, it just happened today. Most likely it would resolve in a couple days. This is just going to help knock it out that much quicker. And most often I'd probably do 1 or 2 visits for something like that, if it were even warranted, okay?
Thank you.
You're welcome.
Still have a headache? Do you still have a
It's-
headache?
It's a little bit there, but it's not like it was. Not like it was.
Oh, mine's a little.
So oftentimes, what will happen too is some people do get sore. Generally when we're knocking on big nerves, so when I'm doing like sciatic patients, or if I'm doing elbows, as a chiropractor, my elbows started to give me grief 2 years ago when I was working at a different clinic, which I was seeing about 50 to 60 patients a day on average. Just the repeated adjusting, my elbow started to develop some pain, and it wasn't tendinitis. It almost felt like the ligaments itself in the elbow were just getting too much stress all the time. So when I started working with Dr. Toby, my patient volume went way down. Starting a new practice, trying to gain the trust of his patients and bring some of my old patients over. And my elbow pain started to get better, but it never fully went away. And so I worked for about a year. When I got this, that was the first thing I tried. I was like, let's see. And it took about 4 treatments, and my elbow pain returned once, and so I've had it for 6 months, and I've only had to do one more treatment on the elbow just to I felt it kind of creeping in, and it was after I had substituted for another chiropractor at a high volume clinic. I was like, oh, hello, and there it is. So I was like amazed because we had done tons of different things. I adjusted it, icing it all the time. Like after a big long day of 70 to 80 patients, I'd get home, big old ice pack. I'm like, don't talk to me, I'm watching TV and icing my elbow. So this definitely helped that recovery. I mean, I'm removing the stress was the most important thing, but a lot of people, what they'll do is after that first visit, they will feel positive effects, if not getting continually better for the next couple days. And then after about 3 to 4 days, it starts to normalize and maybe start to revert. And those are just those initial pain relief effects. So with chronic stuff, I like to do a minimum of 6 visits, because if you think about healing takes time. So a bone fracture heals in 6 to 8 weeks. So let's do 6 visits. For a chronic thing, we like to space them out about a week. And then that gives your body the best opportunity. It's still going to keep going once you're done. It's still going to be elevated healing after that, but kind of getting it that shot once a week definitely helps most patients. Very few have I done more than that. Usually what happens is we start moving on to a different spot if they want it.